The Health Ministry is looking into various ways to raise the vaccination coverage for measles, even the possibility of taking to task parents who choose not to have their children vaccinated.
Health Minister Gan Kim-yong said this in Parliament today in response to questions from MP Chia Shi Lu, in light of the recent rise in measles cases here. Cheryl Goh explains.
43 cases of measles. That's the total number in the first 4 months this year, a threefold spike of the 17 cases in the same period last year.
So 33 were not vaccinated, and of which among those who are non-vaccinated, 9 of them were infants, and the rest were generally aged between 1 to 54, so there's a wide variety of age groups.
And with more parents putting their children in childcare, this poses a risk to those in infant care, as many of them are below 12 months and could not be vaccinated. Measles is a highly contagious and serious viral disease, and vaccination is the most effective protection against the infection. Mr. Gan says high vaccination coverage in Singapore not only protects the individuals, but it also makes it harder for the disease to spread, reducing the risk of large outbreaks. The measles vaccine remains compulsory for all Singaporean children, and the vaccination rate among those aged between 2 and 7 years is already above 90%. But with more measles cases expected due to the global outbreaks, parents are urged to be more diligent in getting their children immunized.
I think a large majority of them were just passive, waiting for the next convenient occasion to bring their children for vaccination. So most of them hope that next time when they see a doctor, they can bring their children. But when they see the doctor, the children may be unwell and therefore not suitable for vaccination.
Concerned, Dr. Chia also cited the German example of having the law come down hard on parents with unvaccinated children.
So we've seen in other countries there are restrictions to children who are unvaccinated from attending preschool or even going to school. The German Minister for Health has just proposed that there might be penalties, financial penalties for people who are unvaccinated.
He asks if the same could be done here.
We are looking into various possibilities, and even at the preschool level, how we can encourage and ensure that our children who go to preschool are vaccinated, because this is important.
MOH is also looking at childcare workers in the preschool sector to ensure that they too are covered by vaccinations or are immune, so as to protect the children under their charge.